Ezekwesili. This is the big hard fact on hard facts. This year on Hard Facts, we've been having a very constructive conversation about mental health. It started 3 Fridays ago on Eyes and Nays, where we talked about the Mental Health Act. We actually did that for 2 episodes of Eyes and Nays, and we continued it last Monday on the Big Hard Fact. Today, we're moving beyond the act itself, and we want to look at mental health care in Nigeria as a whole. Today's big hard fact is from the World Bank, and according to the World Bank, mental health care accounts for 3% of government healthcare spending. 3%, Lagos. In the 2023 federal budget, healthcare gets 5.75%. So if you do the math, mental health care can count on about 0.17% of the budget. 0.17%. In Naira terms, that's 615 billion Naira. Now, you and I are lay people, so we probably can't tell whether that's a lot of money for mental health care or whether that's too little money for mental health care, which is why I'm thankful that I have a guest who is not a lay person. She is the chief consultant psychiatrist at the Federal Neuropsychiatric Hospital, Aro, Abeokuta, Dr. Kikyo Ekomi. She's back on the show. Welcome. Good evening to you.
Good evening, Sandra. Thank you.
Lagos, join the conversation, of course. Let's hear from you. What questions do you have about mental health care delivery in Nigeria? Do you or your loved ones have experience with the mental health care delivery system in Nigeria? 0700-993-993-993, 01465-7190. Doctor, my first question. Is mental health getting up to 600 billion from the federal budget? Would that even be a sufficient amount?
No. Mental health is not getting that type of amount. And then health generally, the budgetary allocation is very, very low. And then you can imagine what mental health would get.
Okay.
And it's only now that mental health is getting the necessary attention with the passage of the bill. So maybe it would increase, but by and large,
it's not getting it. The president of the Association of Psychiatrists in Nigeria, Taiwo Bindo, he said that 60 million Nigerians suffer from mental illnesses of different types and different degrees. You're nodding your head, so you agree with that estimate?
Well, it depends, but researchers have proven so far that like 20 to 30% of Nigerians have mental health issues. So if we do the math, 20% of 200 million, that is 40 million. So if it's 20 to 30%, that is 40 million to 60 million.
So that's within the range.
Yep.
Goodness, that's a significant number.
Yes.
That's a significant incidence of mental illness in Nigeria.
Yes.
And I guess this shouldn't shock anyone because, I don't know, if people are shocked, I don't know. Maybe it's because they have I'm looking for a nice way to say this. They have a very narrow understanding, of what mental illness looks like.
Because I'm sure that a lot of people would think, oh, do you mean that 40 million Nigerians are mad?
So could you explain to Lagos how we define mental illness?
Okay.
What does it encompass?
Okay. So let me start with the definition of mental. Mental first. Mental does not mean madness. And I always say this wherever I go to. Because when Nigerians hear mental, the first thing that comes to their mind is madness. Mental is a technical term for mind. Just like when we say cardiac means the heart. When we say osteo, it means the bones. When we say ophthalmology, it means you are referring to the eye. So we have different medical terms. When we say renal, we are referring to the kidneys. So when you hear mental, we're referring to the mind. So when we say mental health, it means the health of the mind, the mind health. So the next question is, where is the mind? The mind is situated in the brain, within the brain, so and your brain is a biological organ that is resident in your skull, inside your head. So that means your mind is from a biological organ. So that means your thoughts, your emotions, your behavior are regulated by a biological organ, as against spiritual things.
I like that you stress that.
Yes.
As against
spiritual things.
it sounds like that's something you deal with quite a bit in your line of
deal
work.
with that misconception a lot. And it's because when we talk about the functionalities of the mind, it is not palpable. Like, okay, if I tell you about heart beats and I put a stethoscope to your ears, you can actually hear. Yeah. But can I hear your thoughts?
No.
It's very, very abstract. So we deal with a lot of abstract things when it comes to mental health. So because of that, a lot of times people don't understand. And in fact, some people even think their minds is in their chest. And then the symbol of love is the heart. And so some people think that your emotions and your when you're happy, when you're sad, everything is coming from the chest. No, it's not coming from there. It used to be thought, back when the knowledge about medical science was still infantry, and it was thought that because the heart pumps blood around the body, so it must be the one that pumps warmth and emotions around the body. And then when you are in love, you feel this warmth and you feel this physical sensation. So at that time it was thought that
it was the heart doing
so that you love with your heart. So yes, you love with your heart, but this heart is
in the brain.
Yes,
you love with your heart's brain.
Yes,
your brain's heart.
Yes. So mental health refers to the health of your mind. So when we say let me go further. So when we say mental health, what is it? What does your mind do? It simply means thinking or feeling or behaving in ways that enhance your productivity, that enhances your ability to adapt with changes and to cope with adversities. It means you're thinking and feeling and behaving in ways that enhance you relating with other people well, helping you to live like a normal human being. Thinking and feeling and behaving in ways that help you to make the right choices and decisions. That's just what mental health is all about. So if people have this understanding that mental health is what helps you to function as a human being when it comes to making decisions, when it comes to making choices, relating well, doing your job whatever job you are doing. Maybe you are a
journalist
student,
like me,
a journalist, a broadcaster, an engineer, a corporate person. You are selling oranges by the roadside. Whatever you are doing, there's no endeavor in this life that you don't need your mental health, because you have to think, you have to relate with people, and this involves emotions and also your behavior, your actions, and the way you react, your attitude. That's what mental health is all about. So when we say mental illness, we're talking about any aberration in any of these areas.
Aberration is big word.
Okay, any abnormality in any of these areas. So maybe somebody cannot think well. You cannot. You keep making the wrong decisions. You are not productive at work. You are not delivering. You are not rising up to your potentials. You know that you can do this, but something is holding you back. Yeah, maybe you a task that should normally take you 1 hour is taking you like 5 hours, and you are making mistakes. Or maybe you are a mother. You are not taking good care of your children, or you are not taking good care of the house, or you are an executive and you are not motivating your workers. You are not enabling them to bring their full resourcefulness to the table. You are not anything, or you are an orange seller, and you are so irritable that people don't even want to buy from you. So these are mental health problems. So any abnormality in the way people think, in the way they feel, in the way they behave, in the way they react is mental health condition or mental illness or mental disorder.
Goodness. This Wednesday, that's next tomorrow, my husband is going for his annual medical checkup, right? And they're checking every aspect of his physical health. So when I was telling him about today's show and, what I was planning to do on today's show, he was like, nobody's giving me any annual mental health checkup, and that got me thinking. And I have to ask, and I'm glad you're here so I can ask you, is there a mental health version of the annual medical exam?
Unfortunately, there's none. When people talk about, I'm going for a health check, it's usually physical health. And you see, I'm not saying this because I'm a psychiatrist, but we know the centrality of mental health. There is no health without mental health. And let me tell you, if you ask me which organ is is the most important in the body? I'll tell you, it's the brain. All organs are important. Of course, you cannot live without your kidneys, you cannot live without your liver. But when we talk about the functionality and everything, and we talk about them relatively, the brain is the boss of the body. And if we take away that part of the brain that governs the mind from a human being, the person is no longer a human being. The person is no different from an animal. So, because animals, especially mammals, lower beings that the human being is close to, we share so many things in common. They breathe, we breathe. They reproduce, we reproduce. They move, we move. They sleep, we sleep. So we do so many things. Where we differ is in how we function with our brain. They are programmed to act in certain ways. They cannot adapt to habitats that are different from what they are used to. But human beings, because of the nature of our minds, because of the nature of our brains are very flexible. That you hear about neuroplasticity. It is talking about how the nervous system is so flexible, how the human mind is so vast, how you can change it, how you can manipulate it. That's why human beings can solve problems. That is why they can adapt to anything. If you put if you take somebody to maybe a high altitude, the person will think about, okay, how can I survive? You can think. You can think. And then and there are levels. There are levels to mental health. The fact that you don't have a diagnosable condition doesn't mean that you are okay. Because some people will think, oh, after all, I'm not mad, I'm not in Yaba, I'm not in Aru, therefore I'm okay. No, you might not be okay. The fact that you are dressing well and you are speaking normally, you go to work, it doesn't mean that you are okay.
So is there a way to enable early detection of mental illness?
Yes.
What's the way?
Every illness starts small. You rarely see, although there are some aggressive conditions, maybe some aggressive
something
cancers,
traumatic, something triggering.
But by and large, most illnesses will start, from a small place, and a lot of times people just dismiss it or they don't understand. So when we talk about early signs or early symptoms of mental health conditions, we talk about common things that people might just dismiss as something else.
Okay.
It might be changes in your sleep pattern, changes in your appetite, changes with your mood. When you have drastic mood changes, or you cannot, your mood is controlling you, or your mood is crippling your activity, or you are not relating well like you used to, or you are not productive. You know that you are not delivering, even though you are going to work, but you are not delivering. You are not 100%. So this could be early symptoms of mental disorders. It could also be things like forgetfulness. Not being able to concentrate. You are doing something and your mind is wandering here and there. It could also include things like mood abnormalities, like you are irritable. People have to walk on eggshells around you. People don't know what is going to make you angry. Little things, trivial things would make you angry. Maybe at home you are just irritable, mommy is irritable or daddy is irritable, and then it can also manifest as physical symptoms.
That's right.
When you start having headaches that you are always treating with Panadol or anti-malaria, you're always treating malaria every month, or you have unrelenting back pains, you take a lot of painkillers and it's not going, or you have stomach pain, you have maybe some symptoms that you go for all the tests in this world and there's really nothing. So it could be symptoms of a mental health condition.
Goodness. Okay. All right. So there are Lagosians who are listening right now, right? And they're wondering, okay, how do I go about finding out if I need mental health care? What signs should I be looking out for? Where should I go to get checked?
Wow, that's a good question, because, a lot of people talk about therapy. I'm going for therapy. And so the question is, what is therapy and who are these therapists? A lot of people brand themselves as therapists, but let me just educate Nigerians a bit. We have different mental health professionals. It's not only the doctors that work there, and in all fields of health, it's not only the doctors that do the work. We have other professionals. So in the mental health field, we have the psychiatrist. The psychiatrist is the one that leads the team. The psychiatrist is a medical person, is a medical doctor. The psychiatrist first went to medical school, has a medical degree, and then went further to specialize in mental health. Just as is a cardiologist who is a medical doctor who now went at I had to specialize in cardiac matters, and then we have the psychologists. Psychologists learn, about the functioning of the mind, scientific study of the mind and behavior, so they understand how the mind works. So psychologists, we work with them. Psychologists help also, to bring out the best in you. They can help with some forms of mental health conditions that are not serious. They cannot prescribe. Psychiatrists can prescribe because they are not doctors. And then it's only psychiatrists. Well, I don't want to say only, but let me put it this way: psychiatrists are trained to diagnose. And I give you a good example because here in Nigeria, because mental health is a commodity that everybody needs, and we have a shortage of mental health personnel. So a lot of people cash in on this vacuum and they call themselves therapists, So people must really, really know the difference. See, if you have any health condition, that's why it is called health. If you have any health condition, go to a doctor first. You don't have to come to me. You don't have to go to a psychiatrist. Go to your primary care physician. I mean, when I say primary care physician, your general, doctor, somebody that you can just walk up to. I cannot sleep, but just go there first. Why? Because there are some mental health symptoms that might look like, oh, maybe you have a mental health condition. It might not be. For example, there are some other conditions that might masquerade as depressive symptoms. Yes. So, for example, if you are anemic, you can have symptoms of depression. If you have hypothyroidism, you can have symptoms of depression.
What's hypothyroidism?
Hypothyroidism is when your thyroid gland is not functioning well. Okay. It's functioning suboptimally.
Okay.
Yeah. And then if you have the opposite, if you have hyperthyroidism, it can manifest as anxiety. Yes. Then if you have things like maybe Parkinson's disease, that is a disease of the nervous system, it can manifest as depression. If you have things like multiple sclerosis is when the covering of the nerves is affected. The nerve cells make up the central nervous system. So the linings are fatty. Okay. So when the immune system fights against these linings, it's called multiple sclerosis. So it can manifest as depression. Even vitamin D deficiency can manifest as depressive symptoms.
Oh my God.
Yes. So we see what I'm saying this is of course I can't treat everybody. The psychiatrist cannot treat everybody. But when you have any health condition, it's good for you to go to the doctor. The doctor examines you and then narrows down. And then if you need just psychotherapy, the doctor would refer you to a psychologist. It's better that way. But because Nigerians would want to say that, oh, I'm not mad, therefore I'm not going to see a psychiatrist, or oh, my problem is not so severe, it's only that, oh, I'm not sleeping well. Yes, if you feel that your problem is minor, yes, you can go to a psychologist. A psychologist that is genuine, a psychologist that knows his onions would direct you if he feels that this one is beyond me. And meanwhile, we have different types of psychologists too. We have clinical psychologists, we have educational psychologists, occupational psychologists, industrial psychologists, sports psychologists. So we have them differently. So you cannot say, well, because you are not sleeping well and then you go to a sports psychologist. Generally, psychologists help you they facilitate you to be able to enjoy life, to enjoy your mental health well. So psychologists can teach you things like stress management,
cognitive
help you.
behavior.
Yes, and then they identify some factors that can also make you vulnerable to developing illnesses, maybe like the way you think, which when they use cognitive therapy. So cognitive therapy is just like changing the basic way that you think, so they can do things like that. And then we also have social workers. Social workers are also mental health workers. They help to see that the person's basic needs are met. Like, the person has a house to stay, the workplace is good, the person is not being discriminated against, the person is not being bullied in school, things like that.
Sort of thing.
Yes, the person has a job, the person has food to eat, things like that. Your social needs. And then we have counselors. Counselors, they just deal with problems, challenges. They don't go into the core person. They just use the available resources. For example, maybe you have challenges, maybe in your marriage now, you can go to a marriage counselor, But if a psychologist was going to help you with that, the psychologist will go into deeper issues, like maybe how you are thinking, the way you think, or the way you handle things, how it is affecting that relationship. But a counselor will not do that. A counselor is not bothered about how you think or whatever. A counselor would just know, oh, these are the things that you can do, and just a counselor is more superficial than a psychologist. We also have occupational therapists. Occupational therapists help us to live independently. So occupational therapist works with all age groups. Occupational therapists might help, teaching people how to do their chores, how to plan, how to organize things. Some people are very, very poor with their executive functioning, so they delay in delivering tasks because they don't plan. They cannot organize their time, they cannot do all those things. And then sometimes too, maybe a child is not writing well. The occupational therapist can help that child to be able to grasp the pen well. So they help in such things, and it could even be as teaching a child how to bathe, yes, or how to dress.
And we
up.
have all of these professionals in Nigeria?
We do. Yes, we do. So occupational therapy helps to make people independent, as much as it is possible within the limits of whatever they are suffering from. And then we have speech therapists. That one is straightforward. They help with
speech,
language, with speech and language, because there are some conditions that can affect the way people talk. For example, if a child has cerebral palsy, cerebral palsy is when the motor system is affected, and it's an affectation of a part of the brain that affects the voluntary muscles. And then, as we speak, we use the muscles of our mouth.
That's right.
So when that is affected, you need a speech therapist that would help you to exercise the oral muscles, teach you how to speak, or somebody who has had stroke. Now, so a speech therapy would also do. Stroke is not a mental health condition, but it can also have mental health symptoms. Yeah, some stroke patients can even come down with depression. So we have this, different health professionals. So, but when people say therapist is just like an umbrella term for all these people.
For all of you.
Yes. So whenever you are seeing a therapist, ask your therapy. Ask your therapist rather, what his area of expertise is. Don't just assume that he or she will be able to take care of you. Just ask that, okay, what's your areas of training? Because it's your right to know. It's just like if you go to the market, you want to buy meat, you look very, very well, but when it comes to healthcare consumption, Nigerians don't ask questions.
Is it
afraid?
Is it down to the Nigerians or down to how the mental health practitioners conduct themselves? Because you have a number of mental health practitioners who treat you like, don't question me. What do you know that you're questioning me?
I agree with you that there are some characters, and it's not only in the mental health field.
Yes,
it's all over. It's all over. Yeah, but majorly a lot of times.
But it's your right as a patient to ask questions.
Right. And then if you stamp that your right on the table, the person will get the
listen.
message. Yes.
Okay.
Well, Nigerians are usually very afraid.
Once the person is a person in authority, that goes down to how we were raised, and that's a bit of like cognitive.
We are raised not to ask questions,
not to challenge authority.
Yes.
Okay, we'll take a break. When we come back from this break, I've still got the doctor in the house with me. Dr. Yekomi is the chief consultant psychiatrist at the Federal Neuropsychiatric Hospital, Aro, Abeokuta. I'm Sandra Ezekwesili. Today's big hard fact is looking at the state of mental health care delivery in Nigeria, and we just spent some time talking to you about what currently is, how much is available to do what needs to be done, what consists of mental illness, how you can detect it early. So don't go away, because there's so much more to come, and you can ask questions as well.
Hey, my name is Alex. I've been a content creator for a while now, and I always try to innovate to keep my audience entertained and engaged. When 5G came into Nigeria, I thought it was all noise, like the normal hype, gang, and all that noise. But boy, was I wrong. Because I've hosted virtual concerts, partied with my followers in the metaverse, created skits with creators in other countries without ever having to leave my room. I can shoot a movie without being on set. Hey, now that's a godsend. With all the money I've spent on cabs this year, if there's one thing 5G has done right, I would say it's made it easier for me to do me.
With MTN 5G, it offers hyper-fast internet speeds, seamless buffering, and applications that can only be possible via its quality data capabilities. No pichuchu, now MTN 5G. Now available on iPhone. MTN. What are we doing today?
Moves must be made. My people just to work hard. Dreams and challenges multiply. motivate us. But sometimes, when the journey gets tiring, all we need is something to push our limits.
Reactor, ignite your energy, bring out your inner champion. Reactor, reactor, ignite your energy, bring out your inner champion.
Reactor Energy Drink. What you need to push your limits.
Wahala, reactor energy, push your limits, no get tired. No way, reactor energy drink. Reactor.
Push your limits.
Advanced Lafayette Microfinance Bank brings you New Year Bumper Series Promo 2023, where you stand a chance of winning several household items such as freezer, blenders, gas cookers, and recharge cards. You also get an additional 50% interest. Wow! To qualify, simply open a savings account with us and maintain a minimum balance of 5,000 naira in the account. Existing customers with dormant accounts and visit any of our branches to reactivate their accounts. Maintain a minimum of 10,000 naira and stand a chance of winning these mouth-watering prizes. Terms and conditions apply. For more inquiries, call 0700 023 8267. Advance. Growing together.
Whenever I tell people I'm a full-time master's student and a content creator, they go, huh? How are you able to do both all at once? You bewitch? No be juju. Na MTN 5G. Ever since 5G came into my life, I've been on cloud 9. I get to take my classes online in real time and upload my videos before you say Jack Robinson. Even Babe isn't left out. Our long distance is waxing strong.
Hello, babe. Can you hear me? Your video is frozen again.
We don't do that here, because life is a breeze.
Experience the wonders of MTN 5G. Fast internet connection with no buffering, zero lag, and quality data capabilities like never seen before. No pichuju, not MTN 5G. Now available on iPhone. MTN. What are we doing today?
The new cash withdrawal policy by the Central Bank of Nigeria will take effect from the 31st of January 2023. With UBA, you can make limitless banking transactions using the new UBA mobile app or dial *919#. You can also log on to internetbanking.ubagroup.com or bank with Leo on Instagram, Facebook, Google Business Chat, Apple Messages, and WhatsApp. For more information, call 0700 2255 822 or email cfc@ubagroup.com. Terms and conditions apply. UBA, Africa's global bank.
Uncle Dentist, what are cavities and how does Colgate protect my teeth from cavities? Does it use Kung Fu?
No, dear. Most tooth pains are caused by tooth cavities. Colgate Maximum Cavity Protection. Its X formula locks calming teeth and protect them from cavities.
Time to upgrade to the world's most chosen toothpaste, Colgate, because Colgate locks calcium in.
Keeps cavities out!
Colgate is recommended by the Nigerian Dental Association.
At last, the elections are here. Let's turn out en masse on election day and vote Asiwaju Bola Tinubu as President of Nigeria for a renewed hope and a better Nigeria. Vote APC, the party that shows a broom.
Welcome back to your number one talk, news, and sports station. This is Nigeria Info.
What is the state of mental health care delivery in Nigeria? Dr. Onyekome is in the studio with us trying to answer that question. She's the chief consultant psychiatrist at the Federal Neuropsychiatric Hospital, Aro, Abeokuta. And before the break, we talked about the number of Nigerians who could have mental illnesses. We talked about the amount of money budgeted for mental health care in Nigeria. We talked about how to recognize that you might have a mental health condition. Yes. We have people sending us messages online, so let me take a number of those messages.
Okay.
Lagos, you can also be a part of the conversation over the phone. 0700 993 993. Women, call us on 01467190. You can be anonymous if you want to be. What questions do you have about mental health care delivery in Nigeria? Do you or your loved ones have experience with the system? What questions do you have about mental health in general? You can go ahead and ask our guests in the studio with us. 99.3, hello.
Hello, good evening.
Good evening. Thanks for calling.
Yeah, my name is Clement.
Welcome.
Please, I want to ask the doctor, what are the symptoms that make people behave abnormally?
What are the symptoms that make people
behave abnormally?
Okay. What are the symptoms that make people behave abnormally?
Symptoms or the symptoms of abnormal behavior?
I'm not sure what he meant there, and I've let him go, unfortunately. So maybe he'll call back and explain a bit more what he means there. 99.3, hello.
Hello. Hello.
Good to have you on the show. What's your name?
Yes. I want to say I appreciate the speaker. When he was speaking, he mentioned the fact that if you are having issues with your muzzle of your mouth, it will make talking difficult. I have a 3-year plus old that has not been talking, though he normally makes attempt to talk, like making you find that he's saying something that he cannot really make any sense out of what he's saying. I don't know whether such child should be referred to therapy. That's what I want to ask. Thank you.
Yeah, thank you for the question. As soon as possible, please ensure that child is brought to us for complete evaluation. There are so many reasons why a child of 3 years might not talk. It can be secondary to cerebral palsy. It can be due to autism. It can be due to intellectual disability. There are so many reasons. And then the reason why that child needs early evaluation is that by the age of 6, the brain is 90% formed. So early intervention is the best. So the best time to help that child is now. Don't delay. Don't say that, the child would outgrow it. The child might not.
Okay. All right. Thank you very much for calling. 99.3. Hello. Hello.
Hi, Sandra.
Thanks for calling.
Sorry, I'm in my car. I just witnessed a policeman on Adeshola beating up a mentally ill woman.
Oh, no.
She was completely stark naked. And it's just a very horrific sight.
No.
I just turned on the radio now in the car and just realized that you were talking about mental health. So my voice is really shaky.
It's okay.
Because it was very terrible. Everybody was gathered around there, but the policeman just walked off, beating her. She was naked, stripped her, beat her senselessly on the floor, and then he just walked off.
Oh, no. I am so sorry to hear. Where did this happen?
On Akadeshola, right next to Delhi. Actually, between Delhi and Pekingpay.
Okay.
That's an egregious abuse of a mentally ill patient. And coming from a police.
Because who do you report to? You're supposed to report to the police.
Now.
Right.
So who do you report to? That's one of the aberrations we have in this country. A policeman should know better.
Well, thank you very much for bringing it to our attention. The good thing is we can report to people who are higher up than the policemen on the street who are doing this. Akia Deshola between the delis there and Pick and Pay. Thank you so much. Someone from our newsroom will pick this up and follow up. Thank you so much for bringing it to our attention. 99.3. Hello. Good evening. Good evening.
Good evening, ma'am.
Yes.
Yeah, thank you, Doc. Good evening.
Good evening, sir.
Yes, please. I'm just calling for my mother. She had a partial stroke and it came out of this stroke and now is behaving. The whole truth is that she doesn't even recognize me as a son. And I don't know. Sometimes we just walk out of our house and just take the phone for some time before we go inside.
How old is she?
I've been crying and crying, but no, I'm an applicant. I don't have a job.
Okay.
And all this is happening. Don't know what to do.
Okay, so it could be due to so many things. Your mom could have what we call vascular dementia. She could also have depression. So I would advise that you take your mom to see your doctor.
All right. Thank you very much for calling. We've got a message here from Bulky in Ikorodu. Bulky says, why is it that a psychiatric patient will continue to use the prescribed drug continuously?
Yeah, there are some chronic conditions. Like it's like asking, why is it that a hypertensive person or a diabetic person would be on medication for life? But that is just the nature of the illness. Unfortunately, that is just the nature of the illness. But as long as you take your medications, you're okay.
Okay. We've got this message here from Yomi. Yomi says, Yomi's talking about something else that we're not talking about. 99.3. Hello.
Yeah.
Hello. Oh, sorry about that. Call us back if you can. 99.3. Hello.
Hello.
Hi. How are you?
Yeah. Good evening.
Good evening, sir.
Listening to the doctor speak, I just want to ask. So, at what age is it too serious to allow a child? So, I don't know. So, I have two sons. One of my sons, once he was a year and say 8 months, he started talking. And the next one is not saying anything. It's 2 years. Now, I don't even know. There's this neurologist they say we should see, and it's taking so many years to see the neurologist because of the appointment we have. Please, at what point is it that one needs to start panicking, like the child is not responding? Or because my child doesn't even respond to calling his name, or I don't know.
Yeah, it's you need to do something as soon as possible. There's clearly something wrong. So see your neurologist, or if you cannot wait till then, if you're in Lagos, you can go to Yaba. Yaba has a child section there. I mean, they would listen to you.
Yaba, where in Yaba? Sorry.
You can go to Yaba Psychiatric Hospital.
Oh, really? Okay, the psychiatric hospital?
Yes. They have a child section. Yes.
Okay.
And I'm saying yes emphatically.
Yeah, it's strange actually.
Yes, because there are so many conditions that might not allow a child to talk on time. And, a lot of them are mental health conditions. For example, autism, intellectual disability, it might be.
It's because my child plays independently of his brother. He plays with his brother, but, suddenly he's happy, suddenly he's so angry, a lot of stuff. But, they tell you are great and all of that. That's just my worry.
Yeah. I would advise you, madam, please let the child
That's a man.
go for an assessment. Oh, sorry.
That's a man, yeah.
Please, you see, you would lose nothing by going to Yaba, see the psychiatrist there, let them have a complete evaluation of that child, and then everybody is happy.
Okay, thank you so much.
All right, because he's saying that this kid is 2 years old. It could just be terrible twos, but it's also always great to hear professional opinion.
From what he said, that he doesn't like to play with other people, like just with there's likely to be some issues.
So go and have it checked out.
It's better to go there. And
why do people hear? Why do people hear psychiatric hospital and they pause? Why does that happen?
That's because of this misconception. They think that psychiatry is all about madness. It's not. It's not. You see, we have a whole range of mental health conditions, and madness is just like small percentage.
What is even madness?
Okay, good. Now, madness, usually, the people that are termed mad, most of them have what we call schizophrenia.
Okay.
Yes. And schizophrenia, and then sometimes they can have mania with psychosis.
Okay.
They have a psychotic disorder. Now, psychosis means that the person is out of touch with reality. The person's judgment is warped. The person does not know what he or she is doing. Usually, you are asking them this and they're telling you that their thought processes are completely deranged. They might be hallucinating, hearing voices of people that are unseen to some other persons. That's why you can see some people, that are called, mad. We don't like to use that term because it's derogatory, but that is what it is, So you can see them talking to themselves, a lot of times they're actually hallucinating, or sometimes, just smiling, and then they don't know that they are even naked. They look so dirty, so disheveled. Some of them will be hoarding rubbish. It's because they are psychotic, completely out of touch with reality. And I tell you, sometimes we have good Samaritans that bring some of this vagrants. We call them vagrants, people that move from one point to the other. We have some very good organizations that bring them to the hospital, and with the right treatment, you won't even recognize them. Yes. So as bad as that madness looks, there are fantastic treatments, and that is not the only type of
treatment available in a psychiatric home.
That is not the only type of mental health condition that we have. This that this woman mentioned,
Father.
I mean, it's a mental health condition. Anything that has to do with the mind, anything that is in the purview of the mind, if there's any aberration, if there's any abnormality, the best person to go to is a psychiatrist. And then when we're talking about speech and language, it's coming from your mind.
That's right.
That is why it is a mental health condition.
That's right.
Yeah.
Okay. Aya from Ikorodu says, I have a son about 7 years old who could not speak well, but he pronounces words perfectly. Kindly assist.
Yes, there are some children that might not be able to produce sentences. They might just be able to mention words. Some might not be able to read. You can talk to them and they understand. So there are different types of speech problems.
Okay.
So I would still say that let that child be taken for assessment. I can't make diagnosis because I need to ask some
other
questions.
questions.
Yeah.
Okay. There's something that Dr. Bindo said, or he claimed that only 10% of the mentally ill can currently access care.
Yeah.
Do you agree? Oh, well, yes, you agree.
Yes.
Why
and
is that?
For various reasons. Chief of them is ignorance. Some people who are mentally ill don't even know it is mental illness. And then for some that know it is mental illness, they don't want to come for treatment because it means that, to them, it means accepting that they are mad. So it means that they are going to be stigmatized. So they feel that going to the psychiatric hospital would come with a lot of stigmatization. So they would rather, go to other places, like maybe praying, hoping that prayer would take it away. So, and then the third reason is, some people don't have the money because coming to a psychiatric hospital is, you have to spend money. But the chief reasons, ignorance and stigmatization. People fear it a lot. Yeah.
I want to stay with that knowledge gap and stigma thing that you just mentioned. I think they go hand in hand.
Yes.
What are the efforts that the mental health community is making to educate Nigerians about the nature of mental illness so that many people are willing to seek help from the right places? Because they are seeking help, they're just not seeking help from the right places.
Yeah. One of them is, education. Education is the antidote, to ignorance.
That's
so
right.
It's education, talking to people about mental health, educating them on radio, TV, educating them in schools, talking to students, to pupils, and we do this. Honestly, we do it. Yeah.
Okay.
We go to, I'm here now, and I'm educating Nigerians, and we do it, but it's not enough. And then most of the time, because it comes with spending money, and that money is not available. So, but with the new mental health law, that one, there's also incorporated into that, mental health education, anything that would promote the mental health of Nigerians. So the mental health department in the Federal Ministry of Health would see to that. But everything that would want to do would require money. So money is a big crippling factor. Yeah, money. Yeah. Because if I say, Sandra, I want to be talking about mental health every week here on Nigerian Info, they tell me go and bring money.
Yes, so. And it's serious money.
And then companies should sponsor mental health talks. You know, but companies prefer to sponsor dancing, dancing shows. All this entertainment thing, and mental health is very, very important. So sometimes you want to do something, you look for sponsors, and you don't get.
You don't find. Okay. Who are the stakeholders that you, the professionals, need more support from to help conquer the stigma?
Everybody. Everybody. I mean, everybody is a stakeholder because it is the concern of everyone. Your mental health is your concern. And then there are things that at the individual level, there are things that you can do to promote your mental health that will prevent you from breaking down. So you're a stakeholder. Okay. So as long as you want mental health, as long as you have a brain, everybody is vulnerable. That's one thing I usually say, that we all are vulnerable. There's don't say that it can never happen to me. I can never be depressed. I can never have schizophrenia. The only difference is that we have different degrees of vulnerability. There are vulnerability factors. Yeah, some people have more and some people have less. But we are all vulnerable. So we are all stakeholders.
Because we also have brain.
Exactly. So as long as you have a brain,
you are vulnerable.
Yes.
99.3. Hello. Hello. Okay, that person isn't ready. We've got comments. Let me take them. My name is Damilola. I think I have a mental health issue. I don't do well in relating with people, and this makes it difficult to make friends because I grew up like this. I didn't have anyone in my family to help me realize that. Please, what can I do?
Yeah, you can say psychologist. Yeah.
Okay, psychologist for you. Please let your guest help explain why, while taking my bath or just alone, I will find myself muttering out things out aloud. Is this a mental case?
Well, it depends. It depends.
I speak to myself quite a lot.
That's called soliloquizing. Sometimes people think aloud. Yeah. It doesn't mean that you are ill. But when it's only when you are doing something, and it is not conscious, it's not a conscious thing, or I mean, what I mean by not conscious is that you just find yourself doing it and you cannot control it. Then maybe you should talk to your doctor.
Ooh, okay. Taufik from Itire says, I believe there should be massive mental awareness. There's a lot of misconceptions about psychiatric hospitals in Nigeria.
Correct.
Working with the National Orientation Agency will go a long way.
Yeah. Correct.
Okay. Let's take another call. 99.3. Hello. Hello. Off your radio. Off your radio. Hello. Yes. Thanks for calling. What's your name, sir? Good evening.
Yeah. Please, if depression is part of mental health, what do you suggest one does to help oneself? And secondly, supposing somebody is keeping you away from accessing medical help, what do you do too?
Okay, let me start with the second one. If somebody is keeping you away, and maybe somebody is discouraging
somebody is stopping you from getting
mental health care,
getting to see a medical doctor.
Yes, as long as you're an adult, I mean, nobody should be able to hold you back when it comes to your health. It's your health. I mean, some people can discourage you and tell you, oh, don't you have faith? Are you not a Christian? Can't you pray?
No, not that.
Okay.
You have the money to do it.
Okay.
But the money is being kept away from you. What do you do?
That one is another level of...
that's a legal issue.
Yes, that's a legal
issue.
Yes.
It sounds to me like that's something to talk to a lawyer about.
Yes.
But the first question about depression.
Yes, and if you feel that you have depressive symptoms, please talk to somebody, because there are different causes of depression, like I mentioned some. Yeah, so I wouldn't say go and do this, although there are some self-help strategies, but I
talk to a doctor first.
Yes, talk to a doctor first. It would be wrong for me to be just saying
do this.
Yeah.
All right. Thank you so much for calling. So first step, to recap some of the things that we've said today, because we have just 2 minutes left. I know the time flies. So to recap some of the things we've said, anyone at all can have a mental health condition.
Yes, as long as you have a brain.
As long as you have a brain, you could experience mental illness. If you have symptoms that make you believe that you could have mental health issues, it is best to see a doctor.
Yes.
And the first doctor to see is your primary healthcare provider.
Yes.
So see that one, let that one assess you, and then together you can work towards pinning the problem down.
Exactly.
And then if the doctor says go see a psychiatrist, the doctor is not saying that you are mentally ill or that you are mad. The doctor is just saying you may need a doctor who specializes in the brain.
Yeah.
Me, I specialize in heart. This one specializes in kidneys.
Yeah.
The other one specializes in eye. The other one specializes in teeth. This particular one specializes in brain.
Yes.
So if a doctor says to you, go see a psychiatrist,
Yes.
they're simply saying to you, go and see a doctor that specializes in the brain. Because we have both sat down, we've looked at it, we can't see the physical reason why this is happening.
Exactly.
So it may be happening because of a mental reason, a brain reason.
Yes.
So go and see a brain doctor. So when you then go see the brain doctor, you and the brain doctor can figure out what's wrong. So these are some of the high points of what we've talked about. Yes?
Yes.
Is there anything else you want to leave Lagos with? We've got 1 minute.
Okay, the most important thing is that I want people to know that mental health conditions are legitimate biological conditions, just like any other bodily illness.
Just like malaria.
Just like malaria, just like hypertension, just like arthritis, diabetes, name it. And they are highly treatable. Having a mental illness doesn't have to trammel, doesn't have to truncate your ambitions, it doesn't have to cripple your life. Treatment is available. And I mean, trust me, a lot of people have accessed this treatment and they are doing fantastically well. So, and then if you're in the habit of stigmatizing people and think that it cannot happen to you, just like Dr. Sandra said, because because she recapped it so beautifully. Yeah, just like Dr. Sandra said, don't think that it can never happen to you. As long as you have a brain, yes, anybody can develop a mental health condition. But the most important thing is that help is available.
Okay. All right. Lagos, you've been listening to the chief consultant psychiatrist at the Federal Neuropsychiatric Hospital. Yes, we brought the big gun, the biggest gun of the biggest guns. This hospital is at Aro in Abeokuta. Dr. Kike Oyekomi, thank you so much for talking to us on the show today.
Thank you, Dr. Sandra.
Oh, God. Lagos, I'm Sandra Ezekwesili, Ezekwesili on social media. We'll take a break. When we come back, the news at 6. Don't go away.
Let's talk.
And I want to assume that you would run because I want to give the listeners context for the conversation.
In 2019, you were running mate to Atiku Abubakar. What did you learn then that you will not repeat this time?
Yes, when is the president coming out to address us?
There's a few things. One, I have a burden and a passion for young people.
The fact that you have elected a man does not mean then you begin to order him around. The president will do whatever is good for the country at any given time.
Mr. Adeshino, isn't the president responsible to the people?
What should the next president do to root out stakeholders who are complicit?
You fire those that need to be fired are fired. It's looking like a brand new Chelsea, attacking with so much fluidity. And what can you say about that, Martin? I know you follow Chelsea quite closely.
I live close to the Chelsea training ground. That's what you mean by that. I'm not.
And I want to assume that you would run because I want to give the listeners context for the conversation.
In 2019, you were running mate to Atiku Abubakar. What did you learn then that you will not repeat this time?
Yes, when is the president coming out to address us?
There's a few things. One, I have a burden and a passion for young people.
The fact that you have elected a man does not mean then you begin to order him around. The president will do whatever is good for the country at any given time.
Mr. Adeshino, isn't the president responsible to the people?
What should the next president do to root out stakeholders who are complicit?
You fire those that need to be fired are fired. It's looking like a brand new Chelsea, attacking with so much fluidity. And what can you say about that, Martin? I know you follow Chelsea quite closely.
I live close to the Chelsea training ground.